So I enter the question, when do I consume my apple cider vinegar drink? So let me just create a short video on that. A lot of people like to do it at their meals, which is totally fine. Personally, I like to do it in the morning. Sometimes I'll do it at a meal, sometimes I'll do it in the morning, sometimes I'll do both. But in the morning, I'll do about 16 ounces of water, okay? 2 teaspoons of apple cider vinegar. I use Bragg's. You could pretty much use any. Try to do organic if you can. And then 2 teaspoons of lemon. Try to do organic lemon juice. And sometimes I'll do a tiny little bit of sea salt, okay? And I'll dissolve that in there simply because when you're on a low carbohydrate diet, you're gonna dump a lot of water. You're not gonna have the volume of water that you had before, which could trigger low blood pressure if you don't have enough volume of fluid because it's the salt that holds the volume. Plus, the lack of sodium, because you do lose electrolytes on the ketogenic diet, could create some muscle weakness as well, and what's called keto flu. All this could be remedied by a little bit of salt. You basically need a little more salt when you're doing a keto, like 1 teaspoon a day. Okay, if you're doing a high carbohydrate diet, you don't want to do even that much, okay, because you're going to retain fluid. And keto causes you to lose the fluid. Okay, so this is the drink that I like to consume. So the apple cider vinegar will help the digestion, helps blood sugars. It helps reduce hunger and cravings, if you have that. It's a great transition tool as you're doing keto-adaptation into fat burning. The lemon is really good to prevent kidney stones. The type of stones that are more common with a ketogenic diet is the uric acid stones, okay? Because uric acid does go up a little bit when you're on keto. But this is really related to pH. So in other words, if you keep your pH a little bit higher, you're not going to get this uric acid. So if you have strips, you can measure your urine. You want to keep it 6 to 6.5, maybe even 6.8. That's perfect. You don't necessarily want it 5 if you have a predisposition to kidney stones or gout, okay? Just a little tip there. And the way that you would handle that is the lemon juice helps, and also what helps is potassium citrate, which is an alkalizer, and all the vegetables that you're consuming. Another way to slightly raise the pH to make it slightly more alkaline is to add the raw wheatgrass juice powder to it in a little shaker bottle, shake it up. Some people mix both of them together. So there's different ways to handle the pH if you're concerned about having higher levels of uric acid, which doesn't really happen in a lot of people, but it can happen. This is actually more common when you have high carbs, because look at a diabetic. Their risk factor for uric acid and uric acid stones and other types of stones is really, really high. So anyway, when you take it, you can take it in the morning or with meals. Thanks for watching. So we've been getting a lot of success stories, but I don't have your success story yet. So click the link down below and upload your before and after. I want to actually hear about your success story. I want to see your before and afters. And every week we do featured success stories. So click the link down below and share your success.